Thank you all for joining us. We have a really fabulous group of women to talk about some really innovative solutions and hard problems we have to overcome in the realm of extreme heat. And my name is Alex Harris. I'm the lead climate environment reporter at the Miami Herald. If you've been in our city for the last couple of days, you can pretty much figure out heat is one of our big issues, and it will continue to be for the next as long as we don't address climate change. And so today I think this is a great conversation that has applications all around the world from people all over the world. So I'm going to allow each of our panelists to briefly introduce themselves.
Good morning. Thank you for coming, and I'm really happy to be here and all my other wonderful panelists. I'm Dr. Cheryl Holder. I'm a primary care doctor, and for many years, up until December 31st, I was Associate Dean of Diversity, Equity, and Inclusivity at the Herbert Wertheim College of Medicine, and also an Associate Professor in the Department of Humanities, Health, and Society. My main role now is to connect health and climate, so it's clear, it's communicated clearly to my patients, my community, and to the powers that are out here. And I'm also an HIV specialist, and I'm going to go back and do that. But thank you.
Good morning, everyone. My name is Lola Adedokun. I am the Executive Director of the Aspen Global Innovators Group, which is a pleasure. My role there is to give visibility to leaders who are most proximate to the challenges that face us in every sector. My background is in public health and philanthropy. I spent the last 14 years actually working in global philanthropy, so bringing together investments and innovations and innovators and empowering them to be their own decision makers in the solutions that most impact their lives. So it's a pleasure to be here.
Good morning, everybody. I'm Eugenia Kargbo. I am from Freetown. I am the Chief Heat Officer for Freetown. I have been working with the Freetown City Council, leading several projects in environmental management and sanitation. I am also playing the lead role as the sanitation's lead for the city, and I'm happy to be here to talk about the work I do. Thank you.
Great. So I want to just give us a good foundation to jump off here. So I'm going to ask Dr. Holder to kind of talk a little bit about some of the many connections between extreme heat and human health, and maybe you can talk about the most surprising connections.
Let's start with the surprise, because it takes me back to 2016, and that's when my patient came in who couldn't pay her light bill because she had used all her money for her COPD treatment because she was decompensating. It was hot. Summer of 2016 was hot. It is still the hottest year on record. And that's when I had my aha moment. And I'm like, that was my surprise. How did I not connect so much of this with my patient who couldn't pay her bill and her health issues and the climate? And then I started seeing more and more. So when I look at all my patients, I could just give you the tons of symptoms that they've been having. This is 2016. I connected the dot in 2016, my surprise, but it had been happening before. Allergy seasons. Everybody's allergies this year started at least 3-4 weeks earlier. But think of my population. They don't have money to live on allergy medicines for months on end. So it impacts them even more. Your COPD decompensating sleep. Everybody in medicine knows, mainly women come to the doctors. We're trying to change that, men. And women who are older, by menopause, have sleep, you need to be cooler at night to sleep well. And I've had more sleep issues. I had obesity issues. I had the asthma problem, the heat, the anger, the emotional, the learning issues. Every part of our body is impacted by heat. Every part is impacted by the pollution that drove this rise. You know about redlining, because I know I'm speaking to the audience. You know about redlining, so most of the communities I treat, all the highways in South Florida were cut through their neighborhoods. Plus South Florida is a Jim Crow developed city, so you know all the polluting industries come through our communities. So I've been seeing this for a while, but it just get more and more and more. Heat strokes, we just had a patient, one of my colleagues told me of a police officer who came in with rhabdomyolysis from heat exposure, and we're seeing more of that in our outdoor workers. It's just endless. You've seen the list of athletes who've gone down, the heart attacks, the heart failures. We have 34 excess deaths. in Dade County because of heat-related, and we know it's from the climate. So any symptom you can imagine, we use a pneumonic heat wave, and that just basically tells you everything. Heat, exacerbation of heart and lung disease, allergies, traumatic injuries, which nobody remembers. After storm, many traumatic injuries. After Ian, we had several drownings. We had electrocutions, waterborne illnesses, floods, nutrient-rich, diarrheal injuries, rashes. It's just endless, vector-borne. We had Zika, and malaria is coming in. And then not to forget the mental health issues. And everybody is feeling that now, but more so my poor people. So there's so many. So hopefully after this, we've all connected the dots and there won't be any more surprises. My last surprise, and I was surprised this session, this whole event, which is fabulous, the urgency, I'm surprised I don't feel it as much. So that's a surprise I throw out there. Where is the urgency? This is a crisis. This is an urgent situation. I don't know how much time we really have in that regard to make it happen. So that's my other surprise.
Yeah, I think anyone who works in this field, like everybody in this room does, and everybody who has a deep interest in it, the urgency is something we definitely want to hear more of, see more of, especially when you hear from medical professionals who can go into scary detail about the millions of different ways that it affects health. I feel like I learn a new, surprising way that heat affects health every single day. But flipping the coin to like kind of the solutions-oriented angle, which we desperately need so many of, Lola, you have decades of experience in listening to people from all different parts of the economy, all different parts of the industry, to rise up solutions to heat and health and all sorts of other climate ideas. Where do the best ideas come from?
Great question. I have an answer for you. I'll start with this. What a surprise for me as I entered in the space through the public health lens is the lack of connectivity between the public health community and the climate community. It's shocking that we are all speaking about the SDGs, and yet we occupy such separate spaces. And yet we know that when you go to a community, you go to a neighborhood, they're not separate issues. They're actually tackling these issues in an intersectional way. So it's a long way of saying, at last, the global community in health and development have arrived at the fact that we have to invest in local leadership, in their voices, in their spaces, and in their own solutions. So that's been a thrill of mine. They're in the room here. We have a couple of local leaders. You've seen them on the stages. Sylvie Jakbu here who works in the Congo Basin, an activist who works with youth and also keeps truth to power when it comes to the powers that be in the global landscape. And finally, I'll say that in addition to identifying local leadership, it's critical to ensure that there is an ecosystem approach to their innovations, that we're not just investing in one sexy solution, that we're actually creating a space and a platform for them to innovate, to share their learnings with policymakers, with researchers, with practitioners, to give their solutions validity. So that's what's been really super exciting. We have spaces like climate, but I think one of the shocks about being here in Miami is that, and in the US point of view, is that we seem to continue to forget that we're a tiny speck on the globe. And in fact, when we look out to the rest of the world, that's where the leapfrog solutions are actually happening, and yet there's no opportunity to really bring those solutions to the US. And so the opportunity to humble ourselves and know that local is global and vice versa was part of the sort of urgency of the moment.
Well, so you mentioned local leaders, and we are lucky enough to have one on our panel right here. So, Eugenia, can you please tell us a little bit about, so one of the most interesting things I think I've seen about the way that you have tackled heat in Freetown is the focus on public spaces, shading markets, cooling public parks. Why the focus on public spaces, and what kind of problems does that solve? It seems like it's a multiple benefit solution.
Thank you. So just building on the urgency that we are all talking about heat is something that we're experiencing at the moment, and we are seeing inequality, being we've seen inequality and the gap of inequality being widened by the challenges that we face in extreme heat. And we started working on this and prioritizing the market shade cover project and working with women, as women and girls are one of the most vulnerable. Though extreme heat cuts across different sectors and affect different population groups, there are people who are most vulnerable to extreme heat. In Freetown, we have about 72 informal settlements, which are located along the hillsides and the coastal lines of the city. And the growth of those informal settlements has led to massive deforestation in the our coastal lines and the hillsides. And 55% of that population are women. In 2017, we experienced a landslide that killed over 1,000 people in one day, and women were mainly affected. Most of these communities are low-income earning communities, and most of the houses are built from zinc corrugated iron sheets. And also these women are traders. Mostly what they do, they work in the informal sector. And in Freetown, we have 42 markets, and out of the 42 markets, 15 of those markets are shaded market. They are open market without no structure. And so these women suffer from heat, but also from flood. So it was very critical for us to prioritize solutions around helping women and reducing the burden of heat. So what we did was to work with the women and co-create the Market Shade Cover project, which focused on creating shade covers for three of Freetown's biggest market. We made use of heat reflective materials, and we also installed solar light underneath the shade to provide light for the women in the evening. This project, or this initiative, seemed quite straightforward but very, very impactful. As it reduces productivity loss, it helps to reduce economic loss, because most of what they're selling are fruits and vegetables. And it also helps to reduce the health implication and the health risk that these women are suffering from. But most importantly, it also helps to raise the awareness around the risk and how can we work together to build concrete solutions for the city.
Got it. And jumping back out from public spaces, back to private spaces, the more I learn about extreme heat, I'm sure anyone in this room who's looked into it feels the same way, the more I realize that in the US, it's a problem of substandard housing. That is the number one way to solve extreme heat, is make our housing better, make our housing stock healthier and cooler, and keep people safer so they can cool off at night. In Miami-Dade County, there's been some efforts to install more air conditioning in some of our subsidized housing, which in the US, heat is mandatory in federally subsidized housing, but air conditioning is not, which is a problem down here. Yeah. So I'm curious, Dr. Holder, about the role of cooling down homes, and do you see that as a health and heat solution? Is that the way to move forward?
Well, absolutely. The population that doesn't have cooling needs it. So it sounds sort of counterproductive that we know what air conditioners mean, but for the folks who are not as climate privileged and not as privileged enough to have the luxury of air conditioning, cooling is necessary. The housing stock, again, because it was developed in the redlining post-Jim Crow, the poorer communities' housing stock is not well made. It's very porous. Insulation is limited, the flat roofs, the way the circulation is. So yes, absolutely need cooling for their health. Now, part of the cooling problem is that the light bills are so high. So many that do have air conditioners can't afford to run them. So I wish we would find air conditioners that would be solar or some way, or that it's going to be that maybe it's only one room. But there has to be ways that cooling happens that is affordable. So it's good that we're having AC, but it's not the final solution. And unless you bring some dollars to pay that bill, it's going to stay off. And if you don't insulate the housing, like my patient who had housing and had AC, it seeps through the cracks, it seeps through. So it's a whole lot more. And then so much of the population are renters. So if you improve the rental property, they then get priced out. So how do we get mobile units? That's why many times we look at dehumidifiers, which is much more portable, and looking at portable things that can be for renting low wealth communities. So it's definitely a start, and I will never tell folks, don't give poor people air conditioners, because absolutely necessary.
Got it. And Eugenia, I'm sorry, I'm skipping around in the order. Lola, when we talk about these ideas, we need to find ways to lift up people who are facing inequities. We need to find economic solutions to these health and heat and climate problems. What ideas are exciting you right now in your role of sort of getting to listen from the smartest people in the room at Aspen so often? What are some of those ideas that they're hearing surface and have you excited about solutions for these problems?
Sure. One movement that I've been most excited about right now is the collective impact movement. And this is the investment in neighborhoods to create coordinated solutions, both in urban and suburban settings. In fact, this means the investment in both quality housing, but also in the outdoor experience, the planting of trees, creating outdoor opportunities that are, one, educating young people around the opportunities of the outdoors, but also the investment of tree planting and solutions that enable both multi-generational parties to engage in just sort of being more connected to land and energy and cooling opportunities. The other innovations I've seen globally have been actually in some of the larger investments in Ghana, in some of the urban slums in Kenya around tree planting and really tackling and creating pretty, what's the word? I'm blanking on the word here, but just bold and advanced investments in planting trees, both in urban and rural settings. The final thing I'll add is one of our fellows in our network is Satya Raghu, who I feel like you've met, who created greenhouses in a box. And it's an incredible innovation that highlights the role of entrepreneurship in this space. So I'm excited at the moment about the number of entrepreneurs who are finding new ways to build solutions that not only reflect opportunities for growth in the global south, but also in the global north.
I'm so glad you brought up tree planting, because often when we think about climate solutions, there are expensive ones, like how do we fix all of our housing? But there are also relatively affordable solutions, like tree planting, which happens to be a pretty popular bipartisan solution that has multiple benefits. Soaks up floodwater, provides that shade, soaks up carbon dioxide. And I know it's one of the major parts, Eugenia, of your movement in Freetown. I think it's Freetown Tree Town. Can you please explain that initiative and what promise you think it holds?
So speaking of Freetown, the Tree Town, that's a blueprint, and that's one of the major initiatives that we're working on. And one of the major problems that we face is availability of land space. There's very little green space in the city where I come from. Most of the spaces has been used for building of houses and other private use. And so it's really very important for us to bring back nature into urban setting. And because of the massive deforestation that we've seen, we've experienced lots of climate hazard. Over 500,000 trees have been cut down every year, according to the World Bank report. And that in itself creates serious issues when it comes to preserving our water catchment areas, not only on heat, but also our survival. And so the Tree Town initiative was born out of that, looking at all the areas that has been massively deforested, building the data, and finding ways to reforest those areas, but also bring greenery into the city. So the target is to plant and grow 1 million trees, and we're almost there. The planting has been done across different demographical areas and topography, and there are different trees that we're planting in the hillsides. We're planting forest trees along the coastal areas. We're planting mangroves, and within the communities we're planting economic fruit trees and medicinal trees. And the most interesting part of the Freetown the Tree Town initiative is bringing the community into this. So the focus is not on the planting, the focus is on the growing and the sustainability of the tree, because planting is an activity, but growing is a process. And so bringing the community into the planting of the trees and the growing of the trees has made all the difference. We have about over 300 stewards, tree stewards who are responsible for monitoring, tracking, and the maintenance of the tree. Each tree has a unique ID number that is digitally tracked. We have an app which is called the Freetown, the Tree Town, and so every tree that is planted is uploaded to the app. So you can use your phone and go to the website and say Freetown, the Tree Town, and you'll see all the trees that are being planted across the city, and you can find where the trees are located. So each grower is provided with an incentive at the end of the month for caring and taking care of the trees. We're moving to another phase within that project, which is looking at the carbon market. How do we get the trees into the carbon market and ensure that we have more investment to infuse into the project?
I love that you are choosing, obviously, trees that meet the type, but, mangroves along the coast, which build up their own resilience to sea level rise, and fruit and medicinal trees. And I love that it's a community group. Yesterday, on a green infrastructure panel, we had a lot of conversation about green infrastructure projects like yours being a sort of a convener of the community, and you are getting people invested and involved in the solutions. So I love that. And continuing off of that, we've been talking a little bit about how physicians and clinicians are seen as trusted messengers on climate change. And I know with your work with Clinicians for Climate Action, you are sort of working to spread that message and train clinicians to talk more about climate change. Can you tell us a little bit more about that project?
Yeah, great. And one of my titles, which I missed, I am the Interim Executive Director of Florida Clinicians for Climate Action, which I founded in 2018 with another physician as part of this United States effort in the medical consortium in creating clinician climate groups in all the states. And again, our goal is, as Alex said, clinicians, number one, you guys know who's the number one clinician that's trusted in America? No guesses? Nurses. Yes, nurses beat docs. But docs, and you know why. I mean, nurses spend more time with the patients. They're the caregivers. They translate. They're so vital. So I always have to big up my nurses. They create the doctors. Nurses train the docs. And a good nurse, you'll have a good doc. Doctors, a second, pharmacists, trusted. And that's an incredible privilege that we can use. I mean, nowhere else, anybody else, you'll go in with a stranger and in 15 minutes you take everything off. Think about it. That's the amount of trust that our society has created for our position. And we can use that trust, and as we follow through with it, that's million nurses plus, no, million doctors plus, about 20 mil, how many million nurses? I always get my numbers wrong, but a lot. Think about every clinician usually has a panel, maybe 3,000. Most people have seen some clinician in their lives, whether it's the pharmacist, the doctor, somebody. Bring that workforce, train them, educate them, and have them bring that urgency, because what do patients tell us? What do we take when you go see us? What's it called? The medical history. I'm getting you guys, I teach.
We're not awake yet, sorry, more coffee.
So I always do call and response is what, or, Socratic method. My students type not to like it sometimes. But The history, what's the history? Story. So each patient brings a story, and we can tell their story. On their behalf, we tell their stories. And in that story, we get our diagnosis and we treat. And so we have to incorporate what's happening where they live, where they work, where they play, the planet they live on, the environment they are. That's part of their stories. So if we can get our clinicians to be active, then we get that urgent response because we see the health effects, we see the dying, we see it before you see it. Before you realize that you were a little bit angry because it was 95, you had to walk from your parking lot inside, and you meet up with somebody and you were a little bit stressed out, or you didn't sleep well that night, and we can help you connect to say, maybe we figure out how to keep you cool. Then you go advocate and fight to get them to stop the fossil fuel. If we can mobilize those forces, we can really have a greater impact because you basically trust us more than you trust anybody else. And within that trust, we truly care about you. We want you to live. Just like my patients want when they share their stories with me, to come to you. It's not malice, it's not in bad intent. They're so kind. And they just want you to learn from them that they have suffered, and they don't want you to do the same. But you have to act now. So that's where I see our clinicians can do it. What we've started is what you've talked about, of mobilizing the community. COVID-19, because you're public health, if you understand, public health failed us in COVID-19. But the community developed a response in my community, the Black community, because we were burying too many people, we were all sick. And I don't know out there, but I don't know many Black people in Miami who doesn't have a family member who passed or somebody was sick from it. And so they became the public health people. So I got volunteers together. We got the nurses, the doctors, everyone put together, the radio stations, and we mobilized those forces and we trained people on how to give the COVID message. We did social media, Zoom presentation, went to the churches, went everywhere. We developed a collaborative model that we saw back in HIV, that we saw in every pandemic. And so we used that to build our response, which is, we call it Project CHOT, under the HEAT initiative. And in educating clinicians, what do? We give them CMEs, CEUs, everything. And Baptist gave us a free platform, so that's free. But then we got the youth, we got the nurses, we got the community to develop their climate education skills, bring these resources to the health center, give the health center the resources, work with the doctors for 5 minutes, and give stuff to the patients. But it's coming from the community, by the community, because they know they have to take charge. And it is building the strengths and the capacity. Of course, funding is going to be an issue, but we one day at a time. But that's building on what you've been talking about. We've been trying to put it in effect. And bringing the universities with us, bringing the county with us, bringing the major nonprofit hospitals with us, bringing that collaborative effort to make these teams successful. And we've 50 sites that we've identified. We're going to go to 50 sites in the heat areas, and we know where they are. You can map every city in the world, and you know who's at risk. Target them, do the work. And we are hoping that we will at least have them ready to prepare themselves and then vote.
Can I add one point to that, actually, and it speaks to what you're stating. And we don't talk about the economic opportunity there is in this work. It's not just feel-good work. One example in Ethiopia, they committed to planting 20 billion seedlings within 4 years. Ambitious. They've achieved that goal, and more than 120,000 nurseries throughout the country were enabled, leading to over 767,000 jobs. And so even as you speak to the community work, these can be paid positions. This is not just an opportunity to volunteer and to lean on more volunteerism as part of the transformation. It truly is employing community members to do important and critical work.
Definitely.
I would love you to build on that a little bit, because we often talk, I mean, in climate circles, it's always been about how do we get, the public sector is really involved in climate change. And recently the conversation is about how do we get the private sector? How do we get the companies on board? But you occupy a unique role where how do we get philanthropy on board? What role does philanthropy play that public and private sector can't?
No. Well, what they can play is the role that I think they should be playing is the taking of the risk. So advancing and investing in innovations and innovators at early stages is going to be hyper crucial. Investing in those entrepreneurs who have clever ideas that have not been tested at the sort of space and place that it should be. Furthermore, I think philanthropy has a responsibility to contribute to blending and braiding their funding with global health financing. The way that global health financing is structured right now is entirely siloed and built on, an agenda of colonialism and ownership. And philanthropy can sort of serve as that glue between, in the meantime, between those siloed fundings and sort of the conflicting agendas of some global health investors to sort of bridge the gap. As I used to work at the Doris Duke Charitable Foundation, where we invested in both climate, environment, and public health. And because we could see the connectivity between the two, we were able to land on the fact that at the end of the day, the glue investment was an individual leadership capacity building, was in the fact that you had to invest in institutions, researchers, as you note, and the next generation of leaders who bring a multi-sectoral and collaborative lens to the work. So I feel like it's my duty as a recovering philanthropist to call on our colleagues to think bigger about the ways in which they can advance agendas that are nonpartisan, that are bridging and building and weaving some of the strategies that are critical to all of our sectors to advancing a larger agenda.
Can I? I got to tell you Miami-Dade counties, because I am really happy and proud of what's happened here in doing similar things. We're not there yet, but we're started. The HEAT officer that we have was funded from the Adrian Arsh Foundation, but there's a collaborative of many of the community organizations, the Miami Climate Alliance here, Florida Clinicians Climate Action, Catalyst, Clio, a lot of these groups were funded through Kresge Foundation. And that Kresge then pushed policy, and we surveyed many of the residents, and in that survey, heat was #1. So based on how community-based participatory research is done and how when we drive solutions, we got the information from the community, and then we got with the county. And again, political will is key, because we had the right politician at the right time in office that was able to take this data and use it from what the community says, and was able to now take the funding from the foundation and build on it to get a county position. So the county heat officer is now official position, get our heat action plan, get our dollars, and they then leverage the other foundations to fund my organization, Florida Clinicians for Climate Action, to develop the education thing that we've always wanted to do. So we had the philanthropic with the county, but driven from the community, doing that survey and getting that data says heat, 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 and it worked really well with what Adrian Arch Foundation. And so the heat officer we know also came from Arch nation worldwide. And so that is an example of a model that, again, it's not new. None of this stuff is new, because it's the same collaborative model we saw that drove Ryan White funding for HIV, that drove the social determinants approach to the HIV treatment and management in this country, which drove, again, we saw the improvements in health and HIV. So we know it works. But absolutely, we need to have more of that.
Yeah, and building off the fact that you, of course, your position was supported by Arshrock, how do you see your position and your government taking that philanthropic funding and making it more sustainable? I like what you were saying earlier about your building with the tree planting. You are maybe looking into building a carbon market. You're creating those jobs. You're creating a community. How do you make sure that that funding isn't just a one and done? How do you make sure that it builds something sustainable that lasts in your community and makes a long-term change?
Thank you so much. So funding has been a very difficult one to get, as we all know. So as a city, we've been focusing on building plans and, having the strategy, understanding what are the issues and what are the problem. Few weeks ago, we launched the climate action plan for the city, which gives us like an overview of like really what are the overall problems and what are the needs and how are we working through this. And it's been more of a bottom-top approach for our city, working with the communities themselves, with the realization that funding is very limited. So looking at different innovation and working with different partners, such as the Ashrock Resilient Center, but also NGOs and private sector people within Freetown, just building on the data and projecting the issues. So we have done a lot of work around collecting data and information. Few months ago, we did a survey just like Miami, and which helped us to understand like what is the major climate challenge, and for us also it's heat. And one of the things that we realized from conducting that citizen survey is that the level around the risk of extreme heat is very low, especially for women when compared to men. And this helps to kind of give you an understanding of what are the problems, what you should be doing, how are you tackling it. And so a few weeks ago also, in partnership with the NOAA Institute, we also conducted the first ever heat mapping assessment for Freetown, which will help us to really understand where the problems and helping in building a comprehensive plan for the city, which will give us opportunity for more funding and help us to prioritize our interventions and make good use of the limited funding that we have. But it's been mostly working with communities and finding reasonable solutions and sustainable solutions to investment.
Yeah, it seems like you're using this money while you have it to sort of build that foundation, get that data that, is so hard to get, and then you can build your solutions from there and make sure you're targeting the right spot. That data is so important, and like you just mentioned, so part of your continuing medical education training that you guys are doing, it's an effort to make sure that clinicians can recognize the signs of heat and climate change issues, because right now, can you talk about how we kind of have a data gap in understanding how many people are affected by heat?
Yeah, because the heat issue, again, if I'm 2016, I'm seeing these patients daily. So you can imagine the rest of the community with more protected folks don't see this. And our way that we do it in the US, I'm sure it's everywhere, ICD-10 codes, these codes are what communicates to the people who pay us for what we do, what we saw. So unless there's a code to capture what you saw, you don't get paid. And they didn't create any climate codes yet. There still aren't real good ones. There are heat stroke, those acute illnesses, but this chronic exposure isn't really there. To show the link, if my patient COPD, that's a lung problem, decompensated, I'll just put decompensated COPD. But the real issue, the underlying root cause for that decompensation, we don't capture. You'd have to go read the charts to see that, oh, they were really hot, and this was happening, and they, like in Palm Beach, the sugar was burning, and they burned the sugar cane, and that's when the asthma attack. There's no real system to capture all of that. So when we look at the data to prove what we say, well, there's really correlation, and correlation doesn't prove causality, so then for the motivated deniers, that's a term I picked up here, which I love. For those who are motivated to deny, it gives them a real big hook. Correlation doesn't prove causality. We need to have some randomized controlled studies while my patients are dying, and it's like straightforward. It's like, yeah, the fires were burning, my kid brought in with asthma. How much more do I need to put you in some standardized controlled trial here to prove it. So this is our problem, but we need more researchers, and we need different ways of framing the story and capturing the data and reimbursing clinicians for doing this work. And that's when you put your money there, is that if I'm going to take an extra 10 minutes to do this and I know it saves a life, pay me for it. Because that's really what we need to do to keep us from burning out and keep us taking care of you.
So keeping that flow of support from philanthropy going for things like research.
Yeah.
Lola, how have you seen, like, when the philanthropy community looks at climate, is heat the number one issue they're looking at? Is it flooding? Is it the spread of diseases? Like, what is capturing the ideology of the philanthropic industry? Sorry. And where do you see heat rising or falling in that community? Do you think the right amount of attention is being paid?
I don't think the right amount of attention is being paid, but I do think the area that piques philanthropy's interest is around the health outcomes and health equity, actually, as the entry point, which is a great entry point. But I also want to sort of plus one Cheryl's point about the importance of data and the importance of building data systems that are putting out information that is actually useful, not just for decision making at the policy and practitioner level, but actually at the community level. One of the investments that we were able to make in Mozambique actually was building such a data platform. And at the time, this was in 2019, where there was a major hurricane, Hurricane Idea, which happened in Sofala province, and this took out the entire health system. And as a result, some of the repercussions were outbreaks in cholera, vector-borne diseases, as you noted. And yet, because we had built and invested in a platform, a data system that brought practitioners and policymakers and government together, they had the data they needed to know how to make decisions quickly, locally. And typically what happens in those kinds of events is the Red Cross comes in or some outside entity comes in and says, we were going to deploy these resources here, there, and everywhere without engaging government. But because they had this system, it were Mozambicans, policymakers at the district level, who already knew where the hotspots were, who already knew how to allocate resources, emergency resources, food, and all of the needs, and be more responsive than a global reaction would have enabled them to do prior to having the system in place.
Got it. And so building off of that data where you make smart decisions based on the vulnerabilities, I know we talked a little bit ahead of this panel about housing and cool roofs and sort of building materials. Where do you see the next steps for you in Freetown with what solutions you're hoping to bring?
So in terms of housing, most of the housing facilities in Freetown do not have cooling facilities, especially those in the informal settlement. They're either built from cement or zinc. And so we're working with engineers and the national government to build policies and to kind of raise the awareness, but also to see how we can look at different cooling designs and bring in cooling infrastructure and look at different cooling materials that can be used in building and construction of housing.
Got it. And I think actually we have entered the time when you guys get to ask some questions. So if anyone has some questions, please raise your hand, and we've got a mic we're going to pass around. We'll start here with the lady in the white shirt in the front.
Thank you so much. Interesting conversation. I have two questions. Anybody can answer either or both. The first is there's a lot of attention in the heat work on urban heat exposure, particularly around the urban heat island, understandably so. In the southern U.S., we see higher rates of heat-related illness in rural areas where populations have less access to the solutions. So just curious if you know of or can share any solutions specific to rural population and heat exposure. That's the first question. The second is a lot of my work is around maternal health and heat exposure. We have growing evidence around preterm birth and preterm labor, but one thing that's starting to emerge, and I just haven't seen a lot of it, is the impact on women with heat, with violence against women, particularly pregnant women. And just wanted to see if any of you had any thoughts in that space too.
Well, I'll tackle the health part. The data on anger, and that's been proven that it definitely does. Now, I've not seen the link with pregnant women, but overall there's a link of increased violent episodes, urban communities, with heat. So whether it's fighting, gunshots, it's all shown. But the women, I haven't seen the data on that, but I'm not surprised because interpersonal violence increases during pregnancy, and heat does worsen mood and anger responses, so that does make sense. Definitely all the preterm labor, Becker's work, I don't know if Dr. Becker's work has shown that correlation. Again, it's more correlation than actual causality, but it's definitely clear of the maternal issues, preterm labor. And it's, when you look at it, it's dehydration, placental circulation. The physiology makes sense. And also with the placenta, the pollution does go through, so it also makes sense that you will have inflammatory responses, and with the inflammation comes labor. So it all makes sense that we're seeing this, and it's connecting the dots again why we see so many more problems in Black folks who are much higher exposed to this. The rural issue, rural health is just so underfunded, and the problem we see in rural health, a lot of it's in the manufactured homes. And that's, it's a huge problem much in rural where much of the housing is manufactured. And just like you have in Freetown where it's the metal, so it gets very hot. So it's the funding. I hope the infrastructure bill has some funding for that in looking at manufactured homes. But when I looked at, I didn't see a lot of that. It was much more roads and the bigger picture and solar. But I think if we could get a solar-powered cooling system, that would definitely help the rural communities. And I think RV World, I've been talking, somebody's telling me that RV World is pushing a lot for these solar sort of units to cool the RVs. And that may be something that could be applied to these manufactured homes in rural communities.
Yeah, and just to speak around the urban heat island effect, definitely reports and experience shows that where you have a lot of population, a large population, where you have a massive traffic and traffic congestions, where you have taller buildings that are blocking wind flow, you have the urban heat island effect. And so within those areas, some of the things that you can do, one is to raise the awareness for people to be aware and understand what you can do to prevent yourself. But also, this is why going back, data is important. Most of what we lack within the global south and for my city is there's no early warning system to give people that push that this is what's coming, this is what the weather is going to be. So we really need that information, but also looking at different infrastructure and building models that you can use. The things that you can do. You have green roofs. You can plant flowers and trees and urban gardening in those areas just to lower the temperature. So there are lots of things that you can do, a lot of solutions that you can apply. But it's really very important to understand that these are the hotspots and these are the issues, so that you can work on comprehensive solutions.
I'd also add one policy innovation that occurred in the last 3 years in the U.S., but has been happening in the Global South for a while. It's cash transfers. So when we were in the thick of the pandemic and the introduction of the cash transfers, direct cash assistance to primarily women, it actually helped reduce reduce stress around mental illness, improve mental health, but also when we talk about violence in the home and empowering women to make decisions that benefit them and their families, cash is king. It's not sexy, but it's just, when we talk about practical solutions, it's direct financial resources that empower families to overcome some of the greatest challenges.
But there is documentation about the increase of violence.
Hold on, let's grab you a microphone, because I know you had the next question.
Answer the question, because there is
Right to your right.
There is a lot of data on that, and it has increased over the years in terms of violence against women when it gets extremely hot. That is a fact, and we got to do something about that. But that's not, because nobody answered that question up there. And
I'm sorry, I thought I said. Okay, good.
You said there was no data.
No, I said there was data on that.
Oh,
No,
okay,
you're
I
fine.
misunderstood.
You always got my data. We worked together for years, so he always calls me out.
We got conscious contractors representing today.
One of the things I want to talk about is the creation of the CHOs, the chief heat officers throughout the country, and most of them are women, you know, which I think is we were the first here in Miami. I got to brag about that, you know. We were the first to recognize that we needed somebody doing that. But the other thing I don't think is really talking about is changing our culture. Here in Miami, there's more planting of palm trees, which do nothing for the environment whatsoever. And if we don't start thinking about how do we change our culture in terms of what are we planting, where do we plant it, what are we planting it for? If we're not even teaching our children good. You know, the schools are doing a terrible job when it comes to environmental disasters and climate change. I'm real disappointed in the Miami public school system. But I do have hope with our newly elected mayor, county mayor. She has taken some steps because she came up through the ranks just like I did, you know. She knows some of the problems here. So I think we got to be more solution geared, and we need more women in leadership positions. I will beat the drum over that forever and ever.
We'll see the gentleman in the back.
Hi. This panel was worth coming to this event alone. Thank you so much. This has been the most intersectional conversation, so spot on, just phenomenal. Thank you so much, and thank you so much for making trees part of this. I'm Jad Daly with President and CEO of American Forest. We've been working with partners like Lola, on tree equity as a vision and a goal for American cities, and tree inequity is a problem all around the world. A map of trees is a map of income. It's a map of race in ways that transcend income in cities and towns all around the world. And just so grateful that you lifted that up as part of an intersectional approach to addressing extreme heat. And for anyone who doesn't know, here in the United States, the Inflation Reduction Act has $1.5 billion to deliver tree equity in our cities as part of an intersectional approach to extreme heat, thanks to leadership from Senator Booker and Senator Stabenow and the late Representative McEachin. So I think we have a chance to show what success looks like here in the U.S. But you all put your finger on something I just so appreciate. I want to ask you for guidance for all of us about how do we get, it's an intersectional solution, but as you noted, the sectors aren't really coming together as tightly as we can and should. And particularly this health sector, divide between folks who are working on different aspects of the climate resilience solution. How do we make that connection? So you've mentioned so many great ideas. If you had to prioritize one or throw another new one on the table, what's the single best thing we can really all crowd in on together to get the health community and the climate resilience efforts better linked? Is it the data gap? Is it something else? What is it that will really help us bridge that divide so we can be one team in saving lives from extreme heat with all the different things that we need to do?
Money talks. And the doctors, you hear burnout, the whole team, not just the doctors, but the entire team that works with the patient has got to be compensated for prioritizing this work and bringing it up to the top and the urgency. So if we don't prioritize it and pay for it for the team, not just the doctors, but the nurses, the medical assistants, everyone who works there has got to benefit as we compensate for doing this work, because we're trying to save the world here, we're saving the planet. And you think of any other emergencies that you have, you don't just leave it to chance. And you put some money there. So that's where I see has to happen. And we have to educate our people. And that's where I see using social media, which everybody's on, and paying, whether volunteers, social media, getting folks out there to educate folks on what it is. Because, you talk about the temperatures in heat islands, 1 to 7 degrees more in these heat islands, these places, and we know where they are. And it's at night because it doesn't cool down. So these are the important information folks got to know, because then how do they do it? Maybe they run the AC just at night. Give them strategic ways to prepare themselves, but to also teach the reality and not run from it, that we have to vote and we have to make the big changes. Individual changes we know won't matter in the long run unless the bigger ones are done, but you have to start where people are. So I think funding education for folks, it should be on every nightly news, TV, TikTok, WhatsApp. I'm telling you, WhatsApp is what worked in COVID-19. It was not network TV, it was not YouTube, well, YouTube a little bit, but WhatsApp for my community, because we're a whole bunch of immigrants. And you should see what went from the Caribbean misinformation from the Caribbean, Africa, Asia came through on everybody's WhatsApp because we're all so connected. But that connection is what we can use to spread and educate. And so there are ways we can do it. So I do educating for the community and paying folks to do the work.
Anybody else want to jump in on that?
One thing I'll add is a global opportunity. The last UN General Assembly, there were massive billion-dollar commitments to a cadre of worker called the community health worker. We see them globally. We see them in New York, where they're embedded in housing, public housing, and elsewhere. And they are the spotters of what's going on in the community. And so what I would hope is that we pay them and train them around this intersectionality that we're talking about here, because they're the ones who, again, have an eye on the solutions, but also have an eye on the problems as they evolve. So if there are already billions of dollars going into that sector, I say this is the moment where we bring in our climate experts to engage with them while they're thinking about diabetes and asthma and housing and jobs and violence within their neighborhoods. We add that as a layered on training opportunity.
I think we have time for one more question. I think you had your hand up next.
Hi, I'm a professor of infectious disease at the University of Miami Miller School of Medicine, and we have data. Even in my field of infectious disease, we're not connecting it very well to climate change, despite the efforts of some of us. But we are watching vector-borne diseases move north across the world. The incidence of invasive fungal infections, non-tuberculous mycobacteria are increasing, unusual bacteria. And sadly, it's rare that I see my colleagues in my field connecting this to climate change. But it's out there, it doesn't cost anything, it's being collected, and we need to connect it because people are seeing Lyme disease in places they never saw it, and getting weird mold infections of the lungs in parts of the world where we never saw it after viruses. People are attuned to infections, especially after the last few years that we've lived through. So I urge you to connect. I would love to be involved in that effort because I really think we have some information that people would respond to.
Yes, thank you.
I think we have time for one question then, if we want to jump in. I think this gentleman right here in the front.
Hi, good morning. Thank you for all the insights that you all have been sharing. You mentioned public housing in New York City, and I'm from the Housing Authority in New York. And one of my questions is kind of, so we're trying to issue out heat projects, extreme heat projects throughout the Housing Authority, but the Federal Emergency Management Agency, FEMA, doesn't provide money through their BRIC program for deaths due to extreme heat. They cover a lot of different things, but if you are trying to do a project to stop people from dying from extreme heat, they will not fund that. So my team and my agency are trying to create a methodology to kind of force FEMA's hand. I'm kind of wondering how my team can get started on developing a methodology that attaches extreme heat directly to loss of life, or maybe extreme heat to different sorts of conditions that FEMA, would like to fund. So, either getting started on that methodology or any innovative projects you've seen from cities of attaching data to their extreme heat projects.
In Miami-Dade County, we're in the same thing, and that's one of our big policy pushes that we're working with. And it's not just Miami, but it's around the country, especially cities. Through the Global Consortium, which is out of Columbia, and you're at Columbia, Cecilia Sorensen, she's the lead, one of the lead physicians and the scientists, and they're out of Columbia. So you can go Global Consortium, because that's one of the areas that we're working together. Kresge Foundation, that's the other group that's working to make heat an emergency that's covered, because it's not declared an emergency, and you don't get money unless it's declared an emergency. So that's one of the big things that we in Florida are working on. But federal legislation is tough. So you've seen some local efforts, and they haven't gone very far. But yeah, those are the groups, and connect with our heat officer here, because the more cities we have working together to get the feds to make it a heat, then it'll be possible.
Well, thank you all so much for your time. Please give these amazing women a hand.